Hi, I'm Jonathan Kraft, and everybody in the hospital knows Dr. Slavin. A year ago, at the start of the pandemic, I recorded a message like this for all the team members of the hospital. And at that time, I said that in times of crisis, it's the institutions of strength, the institutions that communities have trust and confidence in, that get us through uncertain times. And on behalf of the Board of Trustees, I thanked all the team members at Mass General in advance of what we knew was going to be an extraordinarily challenging time. A year later, on behalf of the board, I just want to say thank you again. We had very high expectations, and they were exceeded by the work of everybody in the hospital. Whether it was the ICUs, which back in March and April, May, the COVID ICUs, which I had the privilege of walking through multiple times, where we way outperformed, not just in mortality rates, any other AMC in this country, but with the empathetic care that our nurses, our doctors, our support staff all gave to people who were suffering alone. The most impacted communities that abut where our hospital is, at the start of the crisis, our team members went out and they educated people to the risks, and we provided materials. We dealt with food insecurity, and now we're teaching people about vaccines. The Reagan Institute, Terry and Susan Reagan, they helped fund and bring the doctors together that collaborated on some of the critical work that's gone into the Johnson & Johnson vaccine. And then Boston Hope, a collaborative effort of the entire city, but led by leaders from Mass General. So as we're getting much closer to the end of this horrific period, I just wanted everybody in the hospital to know, on behalf of the entire board, we're eternally grateful. I'd now turn it over to Dr. Slavin, my great friend and the leader of the institution that has performed so admirably.
Jonathan, thank you, and thank you so much for those kind remarks. This past year has been both a horrible and amazing one. The year brought so much sadness and suffering to our patients, our staff, our community, and our country. This highly contagious and deadly virus harmed and killed so many and brought so much pain and distress to families who could not be at the bedside with their loved ones, couldn't support them, hold their hands, or even say goodbye. Our caregivers also felt a deep sense of frustration, wanting so desperately to offer their patients treatments, cures, and hopes, but early on they were left to face off against an unpredictable virus with little information and few weapons in their arsenal. Yet this pandemic also served to shine a bright light on the extraordinary strength, courage, and determination of the entire MGH family. With a passion to heal and help, our staff came in every day and night and cared for the patients who desperately needed their help. They also kept the hospital clean, they kept our entrances secure, they stocked the hospitals with needed supplies, fed our patients and our staff, and did so much more. Our staff was there despite the fear and stress and worry for their own well-being and the safety of their families. Our hospital was hard hit by this pandemic, and people here have felt the impact deeply. Since March of 2020, we have cared for more than 3,000 inpatients with COVID-19, and sadly, nearly 300 of them have died. These individuals were mothers, fathers, sisters, brothers, sons, daughters, grandparents, friends, and neighbors. They are loved, and they will be sorely missed. I also think back on the past year as a time of incredible innovation. I have been in awe of the tremendous creativity and ingenuity spawned by the challenges presented by this health crisis. MGH clinicians and scientists have been involved in the testing of a range of medications and treatments and have played an important role in the development of vaccines. Telemedicine exploded at the hospital this past year at a scale we never could have imagined, and our innovators developed a plexiglass booth called the Hexapod, which has offered a novel means of safely testing patients while preserving PPE. In addition, our teams created a COVID testing clinic in our ambulance garage in what seemed like the blink of an eye. Time and again, staff from many departments briskly and efficiently transformed inpatient units into COVID units and COVID ICUs. Staff who worked on specialty units boldly stepped out of their comfort zones to deliver care to COVID patients who sorely needed it. I was also especially proud when our hospital quickly rallied around hard-hit communities like Chelsea, working hard with these communities since the first surge and through today, working to slow the spread of this disease and now vaccinating everyone in those communities. A highlight for me this past year was spending time visiting with our staff all over the institution, our inpatient units, emergency department, outpatient practices, health centers. And during these rounds, I've had the opportunity to see and hear firsthand the strain and the toll that this pandemic has taken on so many. Yet I've also seen a kind of enduring grit and perseverance among our staff. I've seen the resolve to fight COVID to the bitter end for our patients, our communities, and each other. What I have seen and experienced at the MGH this past year is humanity at its very finest. Thank you so much for making MGH such an amazing temple of healing.
Thank you, Dr. Slavin. Once again, on behalf of the Board of Trustees and all of the senior leadership, to all the team members at Mass General, thank you.